Good morning. What a beautiful day in PEI. So across the country, there are now more than 99,000 cases of COVID-19 and over 8,100 deaths. We've seen some good news in the sense that Nova Scotia has a 40% decrease in the cases in the last 7 days compared to the previous 7 days. We've seen reductions in the number of cases over the last 7 days in Ontario compared to the previous 7 days, and the same for Quebec. It is interesting to note that 18% of the cases in the country since the start of this pandemic have been related to long-term care or seniors' homes, but 82% of the deaths have occurred and been related to long-term care and seniors' homes. There have been a total of 946 outbreaks recorded in long-term care and seniors' homes. Since Friday, we've had 764 new negative tests in Prince Edward Island. We've tested 9,100 people. Our screening at our points of entry continues, and we continue to do our Operation Isolation. I know that being apart for the past 3 months has been hard for families because some islanders are relying on the important support they receive from family members who reside in other parts of Canada, and family members who live off-island are worried about their loved ones and want to be here to help them. So our new family support category of the Compassionate Grounds travel exemptions for the pre-approval travel will allow family members who live in other parts of Canada to travel to PEI in order to support and assist their loved ones living here. Examples of support include emotional, psychological support, personal care, respite, home support, and childcare. Family support is a new category within the Compassionate Grounds exemptions, and I'm happy that islanders in need can now have that help and support. The application process for the family support category will be open later today, and we'll be processing with the Office of Public Safety applications as quickly as possible over the next 2 to 3 weeks. We ask that applicants be patient and allow staff time to review and process those applications. The applications approved under this category must demonstrate that the visit will provide needed and welcome support for islanders. It is not a means for families to come to PEI for solely social or recreational purposes or to have a typical vacation. Family is defined as relatives living in Canada, parent, child, sibling, grandchild, or grandparent. Family members who come to PEI to provide family support must still self-isolate for 14 days. Visiting family members must adhere to the public health measures and restrictions in place related to the current state of public health emergency. Island residents usually will sponsor one family support applicant at a time, and the decision to establish compassionate travel to include family support is based on the COVID-19 epidemiology in PEI and the declining number of cases in other provinces. Now that we have started welcoming seasonal residents as well as others who are traveling to help their family in PEI, we must be even more cautious about protecting ourselves and our families. So I'm asking islanders to remain vigilant and try to maintain our physical distancing, washing our hands, staying home when ill, and wearing non-medical masks if distancing is not possible. In terms of the seasonal residents, there have been over 1,600 travel applications received by EMO, Office of Public Safety, since June 1st. And just over 800 applications have been approved to date, and those are from the Atlantic Canada, Territories, and Western provinces. There are about 700 outstanding, and those are from Ontario, Quebec, and other areas. To give people a sense, and I think this is important, in this week 1 of seasonal residents arriving, there have been 342 seasonal residents approved for this week, and 175 that are expected to arrive next week. And again, there's still applications to process, but it's to give people a sense of those numbers that we know of that are current as of last night. This weekend, it was announced that Quebec will open up for intra-provincial travel and tourism. The Magdalen Islands have a unique geographic position, and they rely on a safe travel corridor through New Brunswick and PEI to allow Quebecers to travel to the islands. And similar to New Brunswick, PEI has agreed to allow any traveler from Quebec heading to the Magdalen Islands to be able to pass through PEI as of June 26, which corresponds to our Phase 4. Conditions for Quebecers wishing to travel through PEI to get to the Magdalen Islands that would minimize the public health risk to islanders include Quebec travelers will have to complete a form provided by Quebec and present it, for instance, at the bridge. They can only travel through PEI. They have to show proof of their ferry reservation at the screening at Confederation Bridge. And that ferry reservation has to be within 24 hours. An information sheet on self-isolation and directions to go to the ferry or to the bridge, depending on which direction they're going, is given to them when they arrive. Similar to the rest of the country, and frankly many other parts of the world, PEI is opening, and actually has opened up significantly in the past few weeks. But as we watch what has happened in different parts of the United States and elsewhere, the COVID-19 virus has not disappeared, and we should proceed with caution, yet optimism. We are gathering in increasing numbers, especially after June the 26th. There may be a bubble with other Atlantic provinces, which will mean many, many more people will come to PEI without self-isolating. And there are more who will be coming soon for family supports. And the seasonal residents, of course, which are smaller numbers than the other categories. We have essential workers who continue to go back and forth. So all these things and people increase our risk of COVID-19. So I implore you, please be careful. Self-isolating, physical distancing, washing your hands have made a difference and will minimize transmission. So it's important as we do more with more people, we continue to practice these actions and really think about how we protect ourselves and each other. So let us enjoy today, be grateful, but be careful. Continue to be kind, continue to be patient, and look out for one another. Thank you.
Bonjour, je vais juste mentionner quelques mots en français à propos des supports de la famille. Et je sais que la séparation entre familles ces 3 derniers mois ont été difficiles et certains insulaires se fient à l'appui de leurs familles qui habitent ailleurs au Canada. Ceux qui habitent hors de l'île sont inquiets de leurs proches et veulent les aider. L'appui familial est une nouvelle sous la catégorie de motifs humanitaires. C'est pour les membres de famille canadiens qui offrent de l'appui émotionnel, psychologique, un appui de répit, de services de garde, un soutien à domicile et personnel pour en faire une demande de déplacement. Je suis bien content qu'on va commencer à recevoir des demandes de voyage pour les appuis familiaux dès aujourd'hui, plus tard cet après-midi. On prévoit une période de 2 à 3 semaines pour les approbations. On vous demande tout d'être patient, de permettre au personnel de bien traiter et évaluer chaque dossier. Pour cette catégorie de voyage, il faut démontrer que l'appui est requis et nécessaire pour appuyer le membre de famille insulaire. Ce n'est pas une voie pour venir à l'île pour des vacances. Les demandes sont ouvertes aux Canadiens comme un parent, un frère ou une sœur, un grand-parent ou un petit-enfant. Les personnes approuvées devront s'isoler pendant 14 jours et devront rester pour un minimum de 15 jours. Quand les personnes arrivent à l'île, ils devront respecter tous nos consignes sanitaires provinciales. Notre décision d'inclure cette nouvelle catégorie est basée sur l'épidémiologie de notre situation locale et le chiffre à la baisse des autres provinces. Et je suis bien contente qu'on va commencer à recevoir des demandes de voyage des Canadiens pour les appuis familiaux dès aujourd'hui. Restez vigilants, gardez les distances physiques, lavez-vous les mains bien et souvent. Restez chez vous et portez un masque non médical quand vous ne pouvez pas vous séparer. Et puis, je vais juste rester là pour le moment et puis passer à Marion. So I'll turn it over to Marion now.
Good morning, everyone. More services continue to open across Health PEI under the guidance of the Services Reinstatement Team. And to date, services have reopened at some level within primary care, surgical services, endoscopy, and ambulatory care services at both Queen Elizabeth and Prince County hospitals, laboratory services across the province, and diagnostic imaging services, including breast screening. Our obstetrics and gynecology clinics, as well as community mental health and addictions, have increased their services. Other services are currently making their plans, and they are being reviewed by the Services Reinstatement Team to ease back more non-essential healthcare services. This is all being done while adhering to physical distancing measures and using the appropriate personal protective equipment. One of the areas in laboratory services that has changed since the COVID-19 pandemic is that our lab has now begun a new process of booking appointments for blood collection services. So in the past, a patient could go at any time for blood collection ordered by their physician or nurse practitioner, and we're now advising patients to please book an appointment in advance by calling your local blood collection setting. If you have a support person with you for an appointment, please call ahead to the clinic on the day before your appointment, so the protocols that are in place for that service will be explained to you. We're looking forward to Phase 4 of the Renew PEI Together plan, and are reviewing again our ability to accommodate additional connections with visitors and family members across our services. We thank you for your patience in this as we adjust to these new processes, and please be patient and respect the processes that are required to keep everyone safe. Thank you.
Thank you, Marion. And we'll open it up for questions.
Brian Higgins, CBC.
Yeah, good morning. Dr. Morrison, can you tell us more about the family support program? For example, how many applicants are you anticipating, and when would the first people start to actually arrive if the application process opens today?
Hi, Brian. So it's difficult to know exactly how many applications will be received, and that is a bit of an unknown. We know that some families have arrived already because they've come because of compassionate reasons. Some family members are actually seasonal residents as well, but there are certainly, we recognize a lot of situations where there's family that don't fall into one of the other categories and yet are really critical. And we've talked here before about that importance of the family connection. So they would start to be processed, and really they could start arriving at a point in time after that. So even if they're processed, for instance, next week, someone may not need to come or want to come until sometime in the middle of July, but that process will start immediately, and I think it's and I'm really pleased about that. We have felt that is a category that we've talked about before. For instance, someone who may have a relative in long-term care, and they have been waiting to try to get home and see them. We have grandparents who really want to provide additional support for families here, and and because they don't have enough support to provide care for their grandchildren, so they are looking forward to making these kind of applications.
Thank you. And a follow-up question, if I may. We see lots of stories about people being worried when they see out-of-province license plates. And I'm wondering if you have any advice to islanders about how to behave when they see people who may be here from out-of-province?
I think islanders should remember that people may have out-of-province plates for a variety of reasons. We have essential workers who come in and out of the province. We have people who have moved here permanently. We have and have just moved here permanently, and so may not have changed their license plates, or maybe they've been here for compassionate reasons and they've completed their period of self-isolation. And I think there are different reasons that people may have an out-of-province plate. I think we are following people who need to be in self-isolation. We're doing that to reduce the risk to islanders. We are, I think, the province in the country that is doing more to follow up and make sure people are self-isolating than many other places. Nova Scotia, seasonal residents, anyone can go to Nova Scotia, for instance, and they're told to self-isolate. They don't have someone calling them. New Brunswick takes information at the borders, but they aren't calling people on a regular basis. Newfoundland tries to call maybe once. So I think we're trying to do some things, not just, we're trying to make sure people have the support they need during that period of self-isolation. And we've said right along, we want to be kind to one another, and that includes everyone who's on Prince Edward Island. And I know we've had questions about people driving through the Prince Edward Island to the Magdalen Islands. We should also remember we have a lot of islanders who drove home in the middle of March or in the last couple months from Ontario and Western Canada. They drove through many provinces, and they drove through Quebec to get here. We drive through Nova Scotia and New Brunswick regularly, and we also need to look after each other and try to still wash your hands, try to keep others safe and yourself safe. But it's all tied into making sure we're doing the best things we can and practicing these public health measures without being always concerned about the license plate on somebody's car.
Thank you.
Okay.
Louise Martin, CBC.
Hi there, and happy Tuesday to you both. Dr. Morrison, just wondering about we know about the protocol traveling to the Magdalen Islands with proof that you have a ferry reservation. What about traveling back from the Magdalen Islands to the mainland and you're coming back through PEI? Is there a plan or a protocol for Quebec tourists who were doing that? They wouldn't really have the necessary proof that they were not going to be stopping on the island or crossing the bridge on any given day?
That's a great question, Louise. So I know that they also will have to have the pre-approval letter from Quebec, and they will be asked, where they are going, and given this information on self-isolation here. And it may be something we need to, after June the 26th, when this starts, we may need to give some consideration about trying to do something different as well. And so it's a good question. We have not solved that issue at this point in time, but we certainly are aware of it and will be looking into it.
Okay, thank you so much. And here's a question that I seem to get from parents and grandparents and teenagers and young children every single day. Can they have sleepovers? And if they can't yet, might that be a consideration when Phase 4 comes into play on the 26th?
So we have had that discussion, certainly with the team, a lot around sleepovers, and we are also getting questions about the sleepovers. And I think we know that play dates and people are having gatherings in people's homes, and and that really trying to maintain that physical distancing. We have said up until now that when people start having sleepovers, the chances of maintaining physical distancing, et cetera, are maybe a little bit more challenging. I think it is something that we talked about as we go into phase 4 here, but really making sure that if the sleepovers were to happen, that they are very aware of that physical distancing component, and are you doing enhanced cleaning of the bathrooms, et cetera. So it's, I think what we'll need to do is put a little bit of wording and guidance around sleepovers to try to keep the families and the people sleeping over, everyone as safe as possible. But I think they need to happen. I think they're probably happening right now. But again, how we can limit the number and keep everyone safe is a discussion we actually had yesterday with the team. And so I hope we'll put something up on the website shortly.
Okay, so for the record, not sanctioned yet, potentially under some guidance. Is that fair?
Yeah.
And I'll say bye.
I think that's probably fair. I just don't have probably the. I want to make sure everyone's comfortable with the wording around sleepovers and the approach, and then we may not need to wait till phase 4, but we'll include that information to the media and on the website.
Thank you.
Okay.
Allison Jenkins, The Guardian.
Yes, hello. I have a question about graduation ceremonies. Just wondering what kinds of requests you've been getting, and if you had any advice for graduates. Two questions there, really.
Hi, Allison. So I'm really glad you asked the question, because it's very timely. It's graduation. I guess my message to the graduates are congratulations, and it's an important milestone, and it seems to even maybe more momentous in the middle of all that's going on. We have given directions certainly to the Department of Education and to the Public Schools branch that graduations need to comply with the guidance around numbers and gathering. And within that, as long as that's being applied, then they are the schools are coming up with a variety of different plans and approaches to that. And so it's to make sure that those that schools have given consideration to the gathering numbers and the enhanced cleaning, how you're going to get people in and out as safely as possible. So I think that's really the big thing that we've been doing.
Okay, thanks. And my next question is about a BBC report on a new drug that's been shown to be very effective in treating COVID-19 symptoms. That's probably not the exact right way to say that, but the drug is called dexamethasone. It's a steroid. Is there any plans to bring that to PEI? And if so, how will that be happening?
So dexamethasone is not a new drug, and we actually use dexamethasone as a steroid here frequently for different conditions. And so in terms of any new drug for treatment of COVID or vaccines, we would be following certainly Canadian guidance on that. We have a technical advisory committee in the country that reviews whether it's new symptoms, new drugs that would be put in place for guidelines in terms of treating. I think they'll be looking at all sorts of potential, and we've said here before, Allison, what we've learned in the last number of weeks about how to treat COVID-19 in this country and across the world will really help us prepare for any future waves, and it'll be one of many factors. These different studies that are coming out at a tremendous rate about COVID-19. They'll all be looked at to see what is the most effective and in what situations.
Okay, so not a brand new drug, just a new use. So thank you very much.
Julien Lecacha, Radio-Canada.
Oui, bonjour, Dr Morrison. Dr Morrison, au début, pour les propriétaires de résidences secondaires, vous avez expliqué qu'à partir du 1er juin, c'était donc les personnes de l'Atlantique qui pouvaient postuler. Ensuite, vous avez donné une autre date, je pense que c'était vers la mi-juin, voire fin juin, pour les propriétaires résidents dans les prairies, l'Ouest et aussi les territoires. Si je comprends bien, je pense qu'aujourd'hui, ces personnes-là peuvent appliquer. Et vous aviez dit aussi en même temps que vous n'aviez pas de date pour les résidents, les propriétaires de résidences en Ontario et au Québec. Est-ce que vous pourriez clarifier la situation concernant tout ça, Dr Morrison, s'il vous plaît?
Bonjour, j'apprécie la question. On a annoncé que les applications des résidences saisonnières, ils vont commencer aux régions atlantiques et puis les territoires et les provinces du Ouest. Et puis ensuite, Ontario, Québec. Alors, ils sont en train de les faire comme ça et puis les mis sur les dates que peut-être il y a des applications des résidences saisonnières des régions atlantiques. Il veut arriver la semaine prochaine ou peut-être c'est le mois mi-juillet. Alors, c'est pas qu'ils vont tout arriver en même temps. Ils vont être ils vont regarder l'application et en mettre dans une semaine qu'ils veulent arriver. Et puis, quand ils finissent toutes ces applications, ils vont commencer avec Ontario, Québec. Alors, c'est pas seulement une date spécifique. Ils sont en train d'en faire. Et puis, j'imagine que s'ils sont déjà décidés à propos les applications des régions atlantiques, ils vont commencer avec la région d'Ontario et Québec. Alors, c'est peut-être qu'ils vont commencer dans les 2 semaines qui suivent, puis avec quelques-unes, et puis plus en juillet. Et on a dit jusqu'à un certain nombre pour qu'on peut les appeler et faire tester.
Très bien. Mon follow-up, Dr Morrison, ça va concerner les îles de la Madeleine. Maintenant, les touristes québécois peuvent donc se rendre aux îles de la Madeleine. Ils n'ont pas besoin de s'auto-isoler aux îles de la Madeleine depuis le 1er juin et il n'y a pas de cas actifs de la COVID-19 aux îles de la Madeleine. Dr Morrison, pensez-vous qu'il sera possible dans les prochaines semaines que les insulaires, donc les résidents de l'île du Prince-Édouard, pourront se rendre eux aussi aux îles de la Madeleine?
C'est une bonne question. Alors, maintenant, si les insulaires veulent rendre au Québec, ils peuvent en aller, mais s'il vient de retourner, à ce moment, il doit être auto-isolé. Alors, si les insulaires veulent partir aux îles de la Madeleine, ils peuvent en aller, mais quand ils viennent de retourner à l'île du Prince-Édouard, ils doivent mettre en isolement.
Très bien, merci.
I'll just translate that last question. It was if Islanders, there were questions about Magdalen Islands, and if Islanders wanted to go to the Magdalen Islands, is that possible? And absolutely. Islanders right now can choose to go to Nova Scotia, New Brunswick. They can go to Quebec or the Magdalen Islands. But when they come back, they need to self-isolate. And so that is still the requirement. So if they leave, they need to self-isolate for 14 days when they come back.
François-Pierre Dufault, Radio-Canada.
Good afternoon to you both. Dr Morrison, en français, j'aurais une question par rapport au déplacement que vous allez autoriser à partir d'aujourd'hui pour du soutien familial. Quelles sont les raisons pour lesquelles vous pourriez refuser une demande d'un visiteur?
C'est une bonne question, François. J'imagine que si les gens font les applications qui démontrent qu'il y a quelqu'un ici, l'insulaire, veut les recevoir. Et c'est quelque chose on a besoin, qu'ils offrent de l'appui émotionnel, psychologique, un appui de répit, de service de garde, un soutien à domicile et personnel pour en faire. Et ça, c'est toutes les raisons. Mais si on n'a pas un plan de s'auto-isoler, ça peut être refusé. Si l'insulaire ne pense pas que c'est une bonne chose qu'il vient, on pourrait le refuser. Et puis, s'ils indiquent que c'est seulement je veux venir pour jouer à la plage pendant un mois, c'est pas pour cette raison qu'on les invite.
Parfait. Et une autre question. Vous pourriez répéter en français un peu ce que vous avez dit par rapport aux plaques d'immatriculation de d'autres provinces qu'on voit de plus en plus à l'île du Prince-Édouard. Comment on doit, nous, comme insulaires, aborder ces gens qui ont des véhicules avec des plaques d'immatriculation qui ne sont pas de l'île?
Alors, les personnes ici peuvent avoir les plaques d'immatriculation d'autres provinces s'ils viennent de déménager ici, s'ils sont des travailleurs essentiels qui habitent ailleurs mais travaillent ici. Ils peuvent être ici pour les raisons de compassion et peut-être ils ont déjà fini leurs 2 semaines d'isolement. Alors, il y a plutôt raison qu'on peut voir les plaques de matriculation d'ailleurs. Et c'est important qu'on prenne soin l'un de l'autre et de peut-être ne pas juger trop vite qu'on voit quelqu'un qui conduit avec notre plaque de matriculation.
Merci beaucoup.
Dr. Rigaud, la voix acadienne.
Good morning to you both. Dr. Morrison, j'ai une question en français sur l'autorisation pour les membres de la famille de venir à l'île. Le 8 juin, le gouvernement fédéral a annoncé qu'il allait autoriser les membres de la famille de tous les citoyens canadiens et les résidents permanents, les membres de la famille qui vivent à l'étranger, de venir au Canada. Est-ce qu'aujourd'hui, si un habitant de l'île a son fils, par exemple, qui vit à l'étranger, est-ce qu'il est autorisé à venir au Canada, mais il sera bloqué à la frontière de l'île et il ne pourra pas rentrer?
Bonjour Laurent, et puis une autre bonne question. Non, si le gouvernement fédéral les permis d'entrer au Canada, on va les permettre ici de rentrer à l'île du Prince-Édouard, mais il faut s'isoler quand ils arrivent pendant les 2 semaines. Et on respecte la réunification des familles qui est annoncée par le gouvernement fédéral. Alors, c'est vraiment qu'est-ce qu'on fait d'une manière ici avec entre les familles, avec les insulaires ici.
D'accord. Et j'ai une deuxième question sur la deuxième vague que vous évoquez régulièrement qui pourrait arriver. L'île a particulièrement été épargnée par la COVID-19. Il n'y a eu qu'une vingtaine de cas. Est-ce que dans ce cas-là, la deuxième vague, est-ce que l'île est plus à risque pour une deuxième vague parce qu'on n'a pas finalement d'immunité dans la population?
Bonjour. Je ne pense pas qu'on a plus de risques pour la deuxième vague, mais vous êtes correct. Je ne pense pas qu'on a pas beaucoup d'immunité dans la communauté, mais Je pense que c'est la même sorte de risque que partout au pays, qu'on peut voir une autre vague, peut-être en automne. Et pour cette raison, ces mesures sont en place. Beaucoup de ces mesures vont rester en place pour un grand bout de temps pour nous protéger. Et il faut qu'on pratique vraiment de nous protéger dans les mois qui suivent pour ça diminue la chance d'avoir un grand vague ici à l'île du Prince-Édouard.
Merci beaucoup.
Just wanted to, I know I'm always, if I don't translate it, I get questions about it afterwards, but would there be any reasons that we would be refusing family who may be applying to come here? And it would be really if families were not able to provide a self-isolation plan, that they, for some reason, the islander did not want them to come, did not give approval for them to come, which sounds, but it has happened, so we're conscious of that. And also if they indicate that really the only reason they want to come is to play on the beach for a month, that's not the intention of this stream of applications. And the other question was about international family reunification that was announced by the federal government. And if the federal government has allowed an immediate family member to reconnect with a loved one here in Canada, then if they were allowed into the country, we would, of course, allow them into Prince Edward Island. And they would have to self-isolate when they're here. So I think that's it. Thank you very much. Enjoy this beautiful day.